Okay, so case number two, let's have a look and see what is going on. Obviously, if you find an abnormality, please do let me know. So we're looking through. So everything looks okay so far. It doesn't look like there's anything grossly abnormal. You want to look at the spaces between the metacarpal, carpal metacarpal joints. Make sure they're all equidistant. There doesn't look like there's any loss of space whatsoever. And that is something they're called light and day signs. So that as if there was a torch on the other side and seeing the light on the other side of the hand going from this way to this way. If you can see light going through, then you're probably not looking at a fracture or dislocation within this region. And this looks completely normal as well. You don't normally get stress fractures within the hand, but you also do want to make sure there's nothing going on with the sort of fifth metacarpal, because when people get punched, what ends up happening is the forces go through in an abnormal way. Instead of punching in the right way, if that's what you're going to do, you end up getting an abnormal translation of forces going down this way. So you end up getting a crack right down the middle, or translation of forces going right to the base of the fifth metacarpal and getting a fracture down here, or even the fourth. But this looks completely normal. We don't see anything abnormal there. Some of you may have seen it. Yeah, exactly. Well done. So hopefully some of you have seen it. Some people have mentioned it, but you also want to look at the interphalangeal joint spaces in general. And you can see on this particular view, this doesn't look normal. At first glimpse, you might think it looks okay. It doesn't look okay. There's an overlap there, which shouldn't be happening. And actually, obviously, the different views will give it to you. And look, that's how important having more than one view can have. You just got to have a look, and you can see that's completely, that is dislocated, probably sort of dorsally dislocated. And because it's been such a high impact injury, you still want to make sure there's no evidence of a fracture anywhere else. But there clearly is, and we'll look how significantly dislocated that is. We could stop at dislocation. We could say, okay, well, you know what? I've told you there's a dislocation there, but we do need to go a little bit further and make sure there's no fracture either. And I mean, there's a bit of a bony sort of looking thing over there, but no obvious defect, and no obvious defect here either. So we can't see a fracture, but you can clearly see that this is a dislocated proximal interphalangeal joint of the little finger. Not a great injury. Most likely, what we always get someone saying they punched the wall. I don't think they do. I mean, do they punch the wall? I don't think they do.